Hello, heart-centered child and family practitioner. Welcome to Holding the Work, Reflections for Child and Family Practitioners. My name is Ashleigh and I'm a children's therapist, social worker and supervisor here in Tasmania, Australia. I created this podcast as a reflective space for practitioners working with children, parents and families. It's a place for us to pause, think about the work and keep growing in ways that are ethical, trauma-informed, relational, and really honours the people that we work with as well as you as a practitioner. I'm recording this episode of the podcast on Mulwinanina country here in Hobart, lutruwita, Tasmania. And I'd like to use this time to acknowledge the Palawa peoples as the traditional owners of the country I'm working from today. I pay respects to elders past and present and acknowledge the knowledge, wisdom and law that has been and continues to be shared on this country with us today. Thank you so much for joining me. I'm really glad that you're here. I'm here with my hot beverage today and really admiring the first little sprinkling of snow on Kunyanyi / Wellington, which acts as a backdrop for us here in nipaluna, Hobart. The sun's out. It's a really beautiful autumn morning and it's just a nice reminder that we're heading into a new season. And for me, the colder seasons are a chance for me to just slow down and really, I guess really similar to what happens in our natural environment where there's lots of things happening under the surface before our spring season kicks in, where everything starts to bloom. So I hope this colder season is a chance for you to slow down as well in your work. I know that's really hard to say, but yeah, I hope it gives you an opportunity to just slow down and take a breath. So as I said, thank you so much for joining me in this episode of the podcast. I wanted to have a conversation about complexity and how we hold it. So working therapeutically with children and families is really relational, meaningful, and often complex work. In trauma-informed practice, we recognise that children don't exist in isolation. We're rarely working only with the child in front of us. We're holding their relationships, their caregivers' experiences, their developmental histories, their cultural and social contexts, and the system that surrounds them. There's layers of attachment, trauma, neurodevelopment, family stress, intergenerational patterns often sit alongside the realities of working in funding frameworks such as the NDIS system, Medicare, and also in out-of-home care contexts. For many of us child and family therapists, this complexity can feel incredibly heavy. Even the most reflective and skilled practitioners can often find themselves asking questions like, where do I begin? What matters most right now? How do I prioritize without oversimplifying anything? How do I hold the whole picture without burning out or second guessing myself? If you ever found yourself asking these types of questions, you're certainly not alone. From time to time, I certainly have asked myself these same things as well. So trauma-informed care reminds us that clarity is not about certainty. It's about slowing down, creating safety, and thinking carefully about our clients and for ourselves. Through thoughtful case conceptualisation, it's one of the most powerful ways that we can do this. So in this podcast episode, I'd like to share with you a case conceptualisation framework that can help us support deeper understanding, pacing that's ethical and intentional clinical choices in our work with children and families. So this particular framework is one that I regularly return to in my own practice and in supervision with other child and family practitioners. And I often use it particularly when the work feels incredibly complex, layered, or emotionally demanding. And later on, at the end of this podcast episode, I'll let you know about a free training that I have about navigating complexity, where I go through this, the concepts covered in this episode in a lot more in depth, and we'll work you through some activities on how you can apply it in your own work as well. So why does case conceptualisation matter in trauma-informed child and family therapy? So case conceptualisation offers us a way to organise complexity without reducing the child or family to a problem. In trauma-informed practice, case conceptualisation isn't a diagnostic endpoint or something that's fixed. It's a living, evolving understanding that often develops over time and is shaped by the relationships that we have with children and their families and networks. It's shaped by safety and also through ongoing reflection. So when held thoughtfully, trauma-informed case conceptualisation really supports ethical and values-aligned decision-making. It helps us as therapists pace the work without rushing change or without having a particular agenda. It helps us to provide clarity when there are competing needs or demands, and though that often comes with the complexity that we work with. It helps to reduce our feelings of overwhelm and self-doubt in our work. And it also acts as a grounding and regulating practice for us as therapists as well. So through case conceptualisation and coming at it with a trauma-informed lens, it helps us to move away from asking questions about what intervention should I use to help this child or family, to questions about what's happening here and what does this system need right now. So when we look at case conceptualisation through a trauma-informed lens, it helps us to consider the felt, relational and emotional safety of children and parents and caregivers. It helps us to consider the nervous system responses and regulation. It helps consider attachment and the relational patterns that we might notice. It helps us to consider and recognise the developmental capacities of the children and parents, but also their vulnerabilities as well. It helps us to consider the strengths of children and families and systems in the network, but also how they've made adaptations, but also the strategies that they've used to, protect themselves as well. And it also helps us to really think about and consider the systemic, cultural and environmental influences that has really shaped the child and the family's experience as well. So most importantly, trauma-informed case conceptualisation really shifts the focus on what do we do to how do we hold the work and how do we hold this family. So the aim of using this particular framework really supports therapists to choose interventions or modalities with greater intention. It helps us to say not yet without feeling like we're being ineffective or saying no or coming from a a power over stance. It helps us therapists to adjust the direction that we might go in when working with children and families, or adjust the pace of our work without losing confidence in ourselves and our clinical decision making. And it also really helps us stay aligned with our professional ethics, our scope of practice, but also the values that really underpin our work as well. So when I'm completing an intake with a family, or reviewing progress, or reflecting on a case in supervision, I often hold this particular framework in mind, and I'll unpack it with you a bit more shortly. So this particular framework really helps me to slow down, organize my thinking, and remain anchored in, I guess, what really matters most for the child and the family. So with this particular framework, it really invites reflection across 5 interrelated domains, and that's through need, function, context, capacity, and safety. So when we work through this framework, it's not about a checklist to complete or something that we get right. Think of it as a thinking scaffold, and one that will evolve over time. So when we work through each of these domains, it really helps us to reflect on those core trauma-informed care principles. So it helps us to think about having curiosity over judgment, meaning over behaviour, relationship over compliance, capacity before demand, and safety before change. So I'm just going to unpack each of those domains in the framework really briefly. And as I mentioned earlier on, I do have a free training available if you're interested in exploring these domains in the framework in more detail. I'll share where you can find that a little bit later on. Okay. So when we explore need, we're asking questions like, what might this child or family be needing beneath what it is that I'm seeing? It asks questions like, are there any unmet developmental, relational, emotional, or sensory needs that are happening here? So when we think about trauma-informed practice and thinking about needs, it invites us to listen beneath the behaviour and the presentation in front of us, rather than responding to what's visible. So when we think about function, we're asking questions like, what might this behaviour, pattern, or response be doing for this child, parent, or caregiver? We're asking questions about how has it supported survival, coping, or adaptation. So when we think about function, it invites respect for strategies that have once made sense, even when perhaps if circumstances have changed, those particular strategies might no longer be needed or as helpful as they were before. So when we think about context, we're asking questions like, what relational, systemic, cultural, or environmental factors are shaping this experience? We ask questions like, what has been happening around this child or family over time? So when we think about context, it reminds us that behaviour and distress don't exist in isolation. When we explore capacity, we're asking questions like, what can this child, caregiver, or system realistically manage right now? It asks questions like, where are the strengths, supports, and limits in this particular moment? Capacity helps us to keep expectations ethical, developmentally appropriate, and compassionate. And finally, safety. So when we're exploring safety, we're asking questions like, what supports a felt sense of safety for this child and caregiver? What supports safety for me as the practitioner working with the child and family? And what needs to be strengthened before therapeutic risk-taking or deeper work can occur? So safety becomes both the foundation and the compass in our therapeutic work. So when we consider this framework in navigating the complexity of the children and families that we work with, it can really help us to make goal setting or direction that we might go in a little bit more clearer and more intentional. So when we're coming at goal setting through a trauma-informed lens, the goals can be less about immediate behaviour change and more about capacity before behaviour, felt sense of safety before insight, relationship before intervention. And often goals might be more subtle rather than dramatic, relational rather than skills-based, developmental rather than outcome-focused, and informed by the collective nervous system of the child and family. So when we think of goals, rather than them being rigid endpoints that we work to, goals can become like guiding stars in our practice. And I guess I just want to also make an point here, and it would be something that you know already. Progress may look slower, gentler, and less linear, particularly when the work involves unlearning patterns that have been shaped by stress and trauma. So when you're using this framework to set goals, it allows the goals to emerge naturally from understanding, provide direction without pressure, and hold process goals and outcome goals simultaneously. So as I mentioned earlier, if you would like to delve into this topic even further and learn more about this particular framework I use and how I navigate complexity, you're welcome to sign up to my free training available through the training library on my website. I'll also share the link below in the video description of this episode of the podcast, so you can find that particular training really easy. So when you sign up to the training, you'll get instant access to a video recording. It goes for about an hour or so. But you'll also get access to handouts and reflective questions to help guide your thinking as you apply this framework to your own practice, as well as if you want to revisit it later on down the track if you begin working with another family that's quite complex. So thank you so much for joining me. I really do appreciate it. I'm incredibly grateful. Your commitment to growth, authenticity, and lifelong learning matters for the children and families you support and for your own sustainability in this work. So until next time, take care.